Right. Okay. Now, as you know, like MRCPCH has few components. Some of them are theory and some of them are clinical. If you put theory as one main component, theory exam has got 3 papers, right? 3 papers, and then you have the clinical exam. Those days, clinical exam was named as MRCPCH Part 3, right? Now we don't use this Part 1, Part 2, Part 3, but we will go by their names. So MRCPCH clinical is a separate component, which we are not going to discuss today, but we will be having some other video to discuss about MRCPCH clinicals. But if you talk about MRCPCH theory, right, there are 3 separate components, right? So those 3 components were happening in a particular way, or the paper composition was different from what they are going to introduce from September 2024, right? So the changes that are going to happen from September 2024 are these. Right. Okay. So if I'm to, right. Okay. So these are the changes to MRCPCH exam, yearly exam particularly from 2024 September, right? We know that MRCPCH theory exam has got 3 papers, right? What are those? Foundation of Practice, also known as FOP. And then we have Theory and Science, also known as TAS. And then Applied Knowledge in Practice, or AKP, right? Now, those theory, we need to pass all these 3 components to get eligibility for clinical exam, right? Now, what do we have to know about these 3 papers, FOP and TAS, right? FOP and TAS and AKP could be attempted in any order. That we need to know very clearly. If you want to do FOP first, you can do FOP first. If you want to do TAS first, theory and science first, you can do that way. Or if you want to do AKP first, you can do AKP first as well. That all depends on what you want to do first. We will go through how to choose whether to go ahead with EAS first, FOP first, or whether to go for AKP first, right? And then FOP and TAS can be attempted on the same day as well. You can do FOP, one of those papers in the morning, other paper in the afternoon as well, right? So if you are very keen to pass the exam like as early as possible, you might do FOP and TAS in one go, pass it, then you would do AKP. Or you would do AKP first, and then you go for FOP and TAS. And as you know, you will have 3 exam attempts, or what we call exam diets, right? So anyone or any student can do these exams 3 times per year, because RCPCH will conduct theory exams 3 times in each year. Now, foundation of practice, that is the first segment of theory exam. Foundation of practice, there will be 100 single best answer type questions. They might give scenarios, and then they will give 5 answers. We are supposed to find out the best answer, right? 100 SBAs, you will get 120 minutes. Each question will get 1 mark. So the maximum mark that we can get for this paper is 100, right? The pass mark varies. In some years, pass mark is like 65. In some years, it is 70. So the pass mark could be around 65 to 70 in general. In some years, it could be low 60s, but if you generally think 60 to 70 will be the pass mark, not 50 or not around 50 either, right? So there will be 100 questions. We are supposed to answer those 100 questions in 120 minutes, 2 hours. So 2 hours, 100 questions. That is FOP, right? And then what is assessed in FOP? If you think I need to do FOP first, right? What are the few things that we need to know before sitting for FOP? Your practical proficiency in pediatric, this will be tested, right? How is this tested? You will face scenarios, right, demanding the application of clinical guidelines, right? Applications of clinical guidelines will be tested. Say constipation guideline may be tested. And then they also might check various types of protocols and then evidence-based practice across different clinical settings. What does this mean? They might test how good you are in communication skills, although it is not a practical test, clinical test, but there are various ways how they would test how good we are in communication. Ethical aspects will be deeply tested, right? A 14 years old child comes with abdominal pain, appendicitis is suspected, child doesn't like to undergo surgery, what are you going to do, right? And then professionalism, right? Child demands not to divulge about his clinical condition to mother, what are you going to do, right? So that kind of things. And then child safeguarding, right? Safeguarding, multidisciplinary approach, those will be tested. And management of common pediatric conditions will be assessed, right? And here they will check how good we are in demonstrating practical skills and guideline adherence, right? So in summary, we need to know a few things about practical pediatrics, how to handle a child with suspected abuse, and then professionalism, how to maintain professionalism, ethical practice, those will be tested in this paper. Also, they will check whether we are used to UK guidelines, particularly nice guidelines and all, management of particular conditions. Say 5-year-old child presents with a suspected UTI. Okay, you have confirmed that it is UTI. What investigation would you do next? So the NICE will clearly say what to do next in case of suspected UTI, right? In a child with constipation with fecal impaction, what is the next step of management? So the guideline will clearly say that we need to show that we are familiar to those guidelines. So that's about FOP, right? And then you have theory and science. Again, there will be 100 single best answer type question, 100 SBAs, and there will be 120 minutes for us. And each question will carry 1 mark. Just like foundation of practice. Just like foundation of practice, but what they test might be slightly different. Theory and science, right? Theory and science. As name implies, they might ask few things about theoretical and scientific dimensions of medicine, or for this matter, pediatrics, right? So we are supposed to know few basic concepts of pharmacology, basic concepts of physiology, some applied anatomy, interpretation of basic investigations, right? Those are the ones that are mainly tested in theory and science paper. They might ask, this child presented with an urticaria rash. What kind of reaction is this? Is it a type 1 hypersensitivity, type 2 hypersensitivity? That kind of questions. Or a child was found to be having recurrent infections, immunodeficiency was suspected, and there will be several other information given, and they will ask what interleukin is affected, right? So that kind of questions could be asked in case of in theory and science paper. a child was suspected to be having hereditary spherocytosis, which protein in red cell membrane is affected, right? And they might ask few genetics. A child presented with, so one of the genetic conditions, they might ask what the possible inheritance is, what gene is particularly affected, what chromosome is affected in this condition, right? So that's basically the theory that they test, and then little bit of applications of theory. So that's about theory and science paper. And then you have applied knowledge in practice, or AKP. Now AKP has got two papers, right? AKP has got two papers. Now each paper will have 60 questions. Each paper will have 60 questions. So two papers, 120 questions. 120 questions. And the total duration is 300 minutes. 300 minutes is 5 hours, right? 5 hours. So out of those 5 hours, 2.5 hours will be given for first 60 questions. That will be a separate paper. And then there will be another 60 questions where you will get another 2.5 hours to answer that paper, right? So there will be total of 120 questions in this paper. The difference is you got a lot of time, right? So to answer 60 questions, you get 150 minutes, right? So to answer 120 questions, you get 300 minutes, right? 300 minutes. So 300 minutes divided by 120 is you get roughly 2.5 minutes per question. 2.5 minutes per question. But if you go to TAS, TAS, theory and science, 100 questions, 120 minutes. So nearly 1 minute per question, right? Nearly 1 minute per question. But AKP, you get 2.5 minutes per question. This is just like the undergraduate exams that we have faced. There also we had like 2 to 2.5 minutes per question. AKP is just like that. Right? Now, AKP, what is tested? AKP, what they test is this is a critical component that evaluate our capability of applying the knowledge into clinical scenarios. Knowledge, the core knowledge was tested in previous 2 exams, and now it is testing whether we can apply that knowledge. So AKP assess the ability to apply theoretical concepts and evidence-based practice in real-world pediatric cases. Real-world pediatric cases. Right. The expected questions are, there will be clinical reasoning, decision-making skills, and then holistic approach. So those will be tested. So to answer AKP scenarios, we need to know more about application, bit of more clinical sense to pass AKP. Now the students ask, what is the best paper to start with? Now the best paper to start with, if that is the question, if you think, now I have been working in pediatrics, in a pediatrics ward for several years, I have good knowledge in applying pediatrics, whereas because I did MBBS or 4 theory subjects long years ago in my university, I have forgotten my physiology, I have forgotten my anatomy, I have forgotten my pharmacology. In that case, I would say AKP would be the best place to start with. Right? When you read or when you follow an AKP course or questions, you will definitely get familiar to most of the diseases that are tested in MRCPCH exam. After doing this, right, if you go for FOP and TAS, and if you study for FOP and TAS, you might feel that it is easier. Whereas if you think, no, application of pediatrics theory to real patients is challenging to me, I rather finish theoretical aspects. I will finish bit of physiology, pharmacology, and then I finish my theory and science. Then I go for foundation of practice, right? After learning bit of communication skills and all, and later with that basic knowledge, I will do AKP. Yes, you can do that as well, right? But I have understood, but I have experienced as a teacher and a consultant who have been doing these sessions for several years, um, like senior pediatricians, senior pediatrics doctors. If you are in pediatrics training or you worked in a pediatrics ward, they prefer to do AKP first. Right? They prefer to do AKP first. Whereas some other students, those who think my clinical decision making skills are not very great, right? I need some time. Yes, you can do it. Then you can go for FOP and TAS first, and then you can come for AKP. But having said that, right? Having said that, I can remember when I did MRCPCH exam, I did AKP, FOP, TAS. Those days, the exam naming was different. However, I managed to pass all these components except clinicals, because clinicals I did slightly later, except clinical when I was a pre-intern doctor. Pre-intern doctor means even before I started working as a doctor in a hospital. What does this mean? If you work hard and if you do the correct practice, you can pass any of these components with single clinical experience. Right? Single clinical experience. Then clinical exam, of course, is different. Yeah, you need a separate training. Right. Now, why did I want to do this? Because previously, if you go through previous question banks, previous papers, you will see different other types of questions like extended matching questions, right? Extended matching questions where you get, say, around 10 options for you to choose, and you need to choose one of them. Sometimes examiner will give 10 options. You will be asked to choose two of them. Say an asthmatic child presents with these manifestations. Which of following options are the best for this child's management? Then you will get 10 options. Then you are supposed to choose two options. Or sometimes they will say this child was presenting with diarrhea, abdominal pain, failure to thrive. You are suspecting, say, Crohn's disease. Which of following two investigations are appropriate? Then you need to choose two investigations, three investigations. So those are known as extended matching questions. Right? From 2022 September, RCPCH has decided not to have any other style, any other type questions, but single best answers only, right? So we'll keep it that simple. If you do FOP, there will be 100. If you do FOP, there will be 100 questions, 100 SBA type questions. If you do theory and science, again, you will have 100 questions. They are all SBA. Then if you do AKP, right, applied knowledge in practice, there will be 120 questions, 60 and 60. They are also single best answer type questions, right? So from September, there won't be any other type questions than single best answer questions. So things will be very easy now, right? There won't be any ambiguity. Question papers will be very uniform. Students will be preparing for 5 answers out of 5. We are supposed to choose one. Each exam, it will be like that. Right. Okay, so that's basically the recent changes in MRCPCH exam. And then I got all these details simply copied and pasted to this PowerPoint presentation from RCPCH website, right? RCPCH website. So if you want to read it again, you are most welcome to go to RCPCH website and search recent changes in MRCPCH theory exam. You will see all these.